And what the Congress doesn't really understand right now, what I hopefully understand as a physician, is that first and foremost, in the middle and at the end of this game, it's got to all be about the patient. And nobody's really talking about the consequences to the patient. So it's a fantastic question, because what we're doing with this steamroller that's going through Congress right now is we are denying the American public access to patient health care. They aren't going to be able to choose their own physician. They're not going to be able to continue in a free market economy with choosing who provides their health care, what level of health care they want. We've seen already through one of the biggest government-run programs, Medicare, which is going to go bankrupt in about 8 years, that it hasn't worked. And yet we're trying to put another government-run program in for the people. And it's going to do nothing but condense health care, deny access to the latest innovative treatments. It's going to reduce experimental work in health care. It's going to reduce treatment options for patients. It's going to increase costs. It's going to have a bureaucrat sitting in some office in Washington, D.C., determining if you are going to get the latest, most innovative treatment based upon your health, your contribution to society. It's just not a good thing for the patient. It's a totally restrictive denial of access, reduction in quality and amount of health care. It's not what the American people and public have been brought up with. It's not what we expect. As Americans, we've always prided ourselves in having choice in almost every decision we make in our lives. And what's more important in a patient's life, in your life, my mother, my children, than to be able to get them the best quality health care and let them have the choice to go where they want to, the choice to spend the amount of money they want to. The choice, quite honestly, if they don't want to have insurance, they don't have to have insurance. Availability is key. Do we really want a government program that's going to make us wait in line to get a hip replacement? If your father's got heart disease, do you want him to be looked at as a statistic to see if he's a good risk candidate for a coronary artery bypass graft, or the government says, no, he's not as good as the next guy, he doesn't get it, he just gets the medical treatment? So it's access, it's availability, it's the timeline that we have to wait on to see a physician, it's the quality of the medical research that goes on. All of these play a very important component in how this all plays out for the patient. It's not about cost. At the end of the day, it's about the quality of health care that I can deliver to my patient and that you, as my patient, are going to receive. And I don't want to deny you the chance to a good life, a long life, a productive life, the best available alternatives to enhance your life. And a public option plan is going to eliminate all of those.